Welcome everyone to another gorgeous fall day here in Michigan. I'm Kristen Taylor, Director of Education and Community Outreach for the Mental Health Association in Michigan, also known as MHAM. If you are needing continuing education credits today, please drop your full name in the chat with the CE that you purchased today, and we will make sure that you get the survey at the end, and once that's completed, I'll send you your CE certificate. With us today is Rae Green. She is founder and president of Sanford Behavioral Health. Rae Green is the founder and president, and her unwavering dedication to mental health advocacy has profoundly impacted individuals and families. Her tireless efforts have transformed countless lives, bringing hope and healing to those affected by addiction and mental illness. Through her dynamic presentations, community engagement, and educational initiatives, Rae strives to reduce stigma, empower individuals and families, and foster a culture that embraces the importance for behavioral health. Rae has made it a personal goal to chip away at stigma associated with substance use disorders and mental health issues. Welcome, Rae.
Thank you so much. Thank you. And you know what, that sounded a little dramatic, unwavering, but it is actually true. It is my unwavering passion because stigma is really the barrier to treatment. So it's so important.
It is. We're so happy you're here with us.
Thank you for having me. As Kristen said, my husband and I founded Sanford Behavioral Health in 2014 to address the gaps in treatment, particularly in the state of Michigan. Mental health, substance use disorder, and eating disorder. We were the first eating disorder standalone residential facility in the state. And it really is our goal to just provide a really safe space for healing. So I am going to change to my number 2 screen. Okay. So these are some pictures of our houses. The middle bubble there is our campus. And what we did was we combined our services into the campus model so that we can treat co-occurring. So somebody might come to us for a detox and then go straight into a mental health treatment unit. And so it gives us some flexibility. And interestingly, since we opened the first residential mental health unit in the state of Michigan, working with Blue Cross Blue Shield in order to do that, a lot of people are more comfortable coming into the mental health space for treatment than they are the substance use disorder space. And so it's been incredible taking down that barrier to treatment. Then someone feels safe in the environment and maybe then eventually agree to the substance use disorder treatment. So so the house on the right, the mansion with the stones, that's going to be reopening, and that's going to be reopening in the end of October for a first responders unit, so that VA and first responders, police, firemen will get specialized treatment because there is, again, so much stigma that is preventing our first responders and our VA from seeking treatment. Okay, so the little beautiful little white house was our first house. We don't own that anymore. We've sold that since we've combined. It was sort of it was hard for me to do, but that was our 10-bed women's. And the reason I'm showing you that picture is because I have a story about some zoning that will speak to stigma in a very loud way. And I'm going to read a quote here. This is an article out of the New England Journal of Medicine. And this quote is, at the societal level, public stigma can lead to discrimination and cause collective, not in my backyard, resistance to the provision of community-based services, as well as shape public opinion in favor of punitive rather than public health-oriented solutions. So I will tell you that when we bought this house and we were so excited, we renovated it for months, and we went to the zoning commission, and the room was standing room only in opposition to the opening of this home for substance use treatment. I have since learned that there were a couple of social workers who lived in the neighborhood. And we had an open house so that people could come and ask questions. And the questions were not friendly questions. They were very combative and resistant. Okay, so that was our first opening, but we opened and it's in a quasi commercial district. So a neighborhood on the side, but some commercial area. So then the second facility, the John Street facility, when we opened that, when we went to the zoning commission, we actually had neighbors from the first property, the Cherry Street White House property, come and uh, I guess testify is too strong of a word, but speak on our behalf. So the difference in that 2 years from people in the neighborhood experiencing that our clients, our clientele wanted more privacy than those actually who were living in the neighborhood. And so it was really at first, my feelings were all hurt and I was kind of discouraged. But then I realized that this was all rooted in a lack of education and understanding about substance use disorder. And so that second house, the zoning, was much smoother than the first. And in Marne, we did the same thing, but that had been a substance use disorder facility in the past, and so we didn't have quite the issue. So this picture is again at that Cherry Street property, and the reason I kept this picture in, it's one of the first marketing photos that we took, and we talked to a modeling agency in town, and we said we'd like to hire some models to come in and take some pictures and have discussions with us so that we can put that in our marketing material. And when the models learned that they were coming to model for a substance use program, a lot of them said they would prefer not to do that project. So again, we were directly impacted by the stigma that is associated with substance use disorder treatment. So stigma, if we look at the word itself, the term comes, you can see that this definition from the Latin and Greek words that mean like a mark on the skin made by a hot iron. And so this often identified, the criminals or the slaves or the outcasts, those who couldn't be trusted. So, just the very word stigma is one that leads to some disapproval or social disgrace. And there's also a lot of dismissive terms that accompany, particularly the disease of substance use disorder. You've got unattractive words like, junkie or stoner or crackhead. And those terms really serve to depersonalize people. And so, stigma is, it isn't only about maybe hurting someone's feelings, but it's really about prejudice and discrimination and in fact a violation of someone's human rights. And so that's kind of the definition of stigma. And I'm going to talk about three different types of stigma. Is everybody, can you all still hear me and everything's okay? I'm just checking in to make sure since I'm far up north and want to make sure my service is good. So, there's a couple, three different ways of defining stigma. And the first one is public stigma. And what public stigma is kind of this guy here under the spotlight. The public stigma is the attitudes that others have about substance use disorder and mental health. And they're generally negative and discriminatory. And it can affect people of all stages of chronic disease, when they're ill, when they're in treatment, and while they're healing, and even when mental health or substance use disorder is a distant memory, that stigma can still be attached to it. So that's what we call the public stigma. The institutional stigma, which is more systemic. And that involves, policies of government and private organizations, whether that's intentional or unintentional, but it limits opportunities for those with mental health. And some examples of this are, some maybe lower funding for mental illness research or, fewer mental health services. And in the end, it really contributes to the underinvestment in quality treatment. And so that's more of an institutionalized stigma. I would say that what we experienced in opening the homes in the neighborhood of Heritage Hill was more of a public stigma. And then the last one is a self-stigma. And this one is a reference to internalized shame. And, this is how people with mental illness or substance use disorder feel about their own condition. And it profoundly changes the way these individuals view themselves. And what happens to then people that feel like that is that they end up putting more energy into hiding their disease than they do into getting help. So again, public, institutional, and self-stigma. Those are kind of the three buckets that that the whole discussion about stigma is lobbed into. All right, so you know what? I'm going to go back to self-stigma. Sorry, I forgot to tell you something about self-stigma. I guess I better look at my notes instead of just going on and talking from the cuff. So this is a quote, how does self-stigma make people feel? And this is a quote that was written by a physician. And this physician was also addicted to psychoactive substances. And after this physician went into recovery, here's the quote that he wrote. Stigma violates the right of people with addictions to be human. It strips us of our dignity and it says we have no value. It evokes feelings of shame so deep they're hard to know unless you've experienced them. This isn't the kind of shame that guides us or tells us that we've made a mistake. It's toxic shame. It's the shame that tells us we are the mistake, something those of us with this disease come to believe. It tells us that we're never safe and it keeps us silent, hiding, and alone, unvalued members of the human tribe. And that's how many of us with this disease die, hopeless, spiritually empty, and alone. When I read that, it sort of blew me away with the power of that statement, particularly coming from a health professional with whom we often assume has great knowledge and understanding and compassion for this disease. All right, so now we'll go on to this one. So research tells us that addiction is actually highly stigmatized, much more so than other mental health conditions. And this study was done by Johns Hopkins Bloomberg School of Public Health. And I'm just going to point out a couple of these bullet points that I think this third bullet point down here. It says employers should be able to deny employment to those with a drug addiction. 64% feel that way versus 25% with mental illness. It's frightening to me that there's even a suggestion out there that employers can deny employment based on a mental health status. The next one is that 43% are opposed to giving drug addicts equivalent health insurance benefits to those afforded the public at large. And I would point out here that this study itself is even stigmatizing by the way they use the term drug addict. And then finally, the last one is that 3 in 10 people believe that recovery from addiction is impossible. So that's a really frightening statistic that we as an industry need to work hard to change. All right, I'm going to switch this one. I let you guys read through some of those bullet points on your own. All right, so nearly 21 million people struggle with a substance use disorder, but it's an embarrassing statistic for our industry that only 20% of those with substance use disorder actually receive treatment, and that being the lowest penetration rate of any chronic disease. And so as an industry, that's something we really need to work at changing. the other thing I'm going to say is that since I've been doing, and I do this slide in a presentation that I do for the clients, and the less than 10% of medical schools that in the last 9 years that I've done this presentation, that statistic has not changed. If you research that, it really hasn't changed. I'm happy to say that the Grand Rapids Michigan State University Medical School does have a track that teaches about addiction. I want to show you where that picture came from. It came from this book here. Such a great picture. And a little farther down, I'm going to read a slide to you, but this is Understanding Addiction. You can see the little play on words, no science, no stigma. And I like that headshot. All right. So this is, okay, I could really get sidetracked on this one, but this is a PET scan of 3 different stages of someone in recovery. And this kind of answers that question of knowing science and then reducing the stigma. And that is that this first brain, and that's the yellow activity, that's the normal levels of activity when someone is using their frontal lobe. And so what happens during the chronic progressed state of addiction is that the frontal lobe basically goes to sleep. And when someone goes into treatment, so that's where the higher level of thinking is, the rational thinking, the decision-making process is all in that frontal lobe. And so you can see here that after 10 days of abstinence, the frontal lobe is barely operating. And so that's when someone maybe gets through detox and then into residential treatment or outpatient treatment. So their frontal lobe is still not operating. And then 100 days. So the 100-day mark, it's certainly waking up. But how does this relate to stigma? This relates to stigma because when someone goes into treatment, oftentimes their family, their friends assume that when they walk out the doors of a treatment facility, that they're healed, they're cured, which of course we know is not possible, but and they're back to their normal selves. But what isn't seen is that this frontal lobe takes almost a year to heal. Now, what I find somewhat interesting, being an old school history major, is that after 100 days of abstinence, you start seeing that recovery. If you think about the 12-step model back in 1936, when Bill W. and Dr. Bob started that support program, they picked 90 days, 90 meetings in 90 days. So they definitely saw something that changed after 90 days, that the decision-making process was a little more sound, that people could, operate in the world a little more in the normal fashion. So I don't think it's coincidence that they picked, 90 days and 90 meetings, and then we see now, decades later, that that's what's shown in the PET scan. There's the landmark report from the Surgeon General that was released in 2016. And in that report, the Surgeon General said that substance use disorder is a brain disease. And that was the first formal report as such that came out. And in 1968, one came out similar to smoking. And what happened after that report is just the awareness of the disease, the awareness of what can happen. By 2015, smoking had been reduced by 64%. So these are powerful reports that the government produces. And then but the consensus is that this is complex brain disorder. However, those with this brain disorder, those with struggling with addiction and mental health, for all intents and purposes, continue to be blamed for their disease, and that's the stigma that we're talking about. All right, let me look at my notes real quick here. Oh, let me get back to, okay, so when this is my favorite lecture to give to clients is the one on neurobiology, because it really gives them an understanding of, why did I make these decisions? Why did I act this way? And the what happens is the behaviors that cause people to moralize about this disease happen when that frontal lobe is asleep. And so the behaviors are those primitive behaviors that manifest themselves in, social, moral, and criminal ways, problems. And so their ability, the individual's ability to make decisions is dramatically hindered. And that really this associated behavior, which is symptomology, that's the symptom of the disease itself, is that behavior is the greatest challenge for us as professionals, for those of us in the field that want to chip away at this stigma. And that's what causes the unease, because a lot of this behavior, violates social norms. And that's really just a symptom of the disease. If you think about, I don't know, let's start maybe diabetes. The symptom is what you eat and the sugar that you consume and the diet that you need to maintain. Whereas this disease, the symptom is the behavior itself. I got a little sidetracked there in the neurobiology because it's so important to understanding. When I talk to clients about the neurobiology of addiction and they understand particularly this phenomenon of the healing process, it's game changing as far as how they feel about themselves. The first question they ask me is, can you give this discussion to my family? Because I really want them to understand what is going on with me and that I didn't mean to make those lies. I always tell them from your heart, you meant what you promised, but it was your brain, your thinking up here that was on the other team. The brain is on the other team with that disease. So, I'm going to go to my next slide because I could keep going on this one. Let's see here. Okay. Um, I want to tell us another story. And this story is about when we first opened, we had a client who came to us and she, I want to make sure that so she came to us, and on the way to treatment, which is not uncommon, she had a bottle of pills with her and she just slugged the pills down. And so, of course, when she arrived to us, we knew we were in danger. We didn't know what she had taken. And so we took her, myself, the owner of the facility, and my clinical director. So the clinical director of the program, the two of us drove her, happened to be a snowstorm, to the emergency room. And I can attest to the fact that we were treated with, I mean, scorn is a strong term, but maybe a little short of that. Is that here's this young woman who's trying to get help and is terrified and takes these pills on her way over. And the emergency room was extraordinarily dismissive of us as we were trying to get help from for this young woman. So let's talk about that for a minute. The stigma on the part of healthcare providers. So oftentimes, healthcare workers are at a loss as how to interact with someone who's acting threateningly. And that goes back to that 10% of people who are trained in medical school. I suppose there would be similar things for PA school or nursing school, but they don't view it as a medical condition, and so they're often dismissive of this, and they don't view it as part of their job. And so I want to read another article, and this again is from a physician out of the New England Journal of Medicine. And here's the part that I want to read. I led two lives for more than a decade. I worked as a physician caring for the sick and suffering. I also struggled with addiction, using cocaine and other drugs to manage post-traumatic stress, a consequence of surviving the 9/11 attacks on the World Trade Center. I loved my work, but the drugs kept me alive, managed my pain, and allowed me to function. This duality showed me how people with mental illness and substance use disorders are treated by my colleagues in the healthcare systems. I saw their judgment and their scorn, and I saw how US drug policy is harming people. Health care workers may shame people with addictions more than others do. So if we stop and think about that for a second, is that when someone, the very place that someone is going to seek help is, where they may feel even more shamed because they're assuming that medical providers understand this disease and what is going on with it. So the very place where someone is going to seek compassionate care, stigma really unleashes its power. So the physician goes on to say, the wrong word, a judging glance, or a prolonged wait to receive care can be a death sentence. Healthcare workers have become the barrier to effective treatment. People with addictions see this and know this, and so do my clinical director and I, and choose to avoid the healthcare systems. Any questions about that? Does anyone I'm going to ask a question and I don't know how you can answer it because we're on this video screen. But, if anyone has experienced that, I would love for you to share, this kind of pervasive level of stigma that has been a little harder, I think, to chip away at. So I'd love to hear any experiences by any of you out in the listening audience. Okay, so this one is speaks to the power of social media. The media often portrays things that lead to self-stigma and a lack of understanding about, the outcomes of treatment. But this right here is an example of sort of the clever, rather, witty marketing tactics of, Facebook page or Instagram page. And this one itself has over 1 million followers. So, this phenomenon, I'm going to use wine moms. I'm sure there are a lot of them out in the social media world. But this wine mom phenomenon, what it does is it turns wine consumption into kind of an identity, if you will, like being a sports fan, or a music lover. And it reinforces the idea that use, or doing this is cute and, funny and maybe necessary, mom saying, their sippy cup at the play park, that kind of thing becomes sort of cute and playful. But what happens too then is people who are in recovery then are feeling like an outsider. It's a kind of that stigma going on at even deeper level. So those who are in recovery or not a musician or, not a sports fan, you feel like you're on the outside of things. And so I would suggest to you that the power of social media, which is a whole presentation unto itself, but it is worth just mentioning during this one on the main topic of stigma. So time for a reframe. So the language that we use, just like that John Hopkins study that, used the word drug addict, but so did that physician when he was sharing his quotes. If you look up the word relapse in the dictionary, here's what you're going to find. You're going to find the word degenerate, digress, deteriorate. So while we may have made progress with the overall changing the overall narrative, in a small way when we went to the zoning committee in Grand Rapids from the Cherry Street House to the John Street House, 2 years. There was, I think, some overall progress that was made. But when it comes to relapse, it's a little farther behind in terms of changing the narrative because relapse can appear to people as, reckless or careless. Someone decided to relapse, to use again. And so, that is when people are hesitant to come back for treatment if it's a relapse versus when they've come in for a first treatment episode. And there's so much shame involved when our clients come back due to a relapse. So here, all we're suggesting here is a simple reframe using the word recurrence, like you would use with the term cancer or another chronic progressed illness. And I'm going to read a little bit about a study that was done. In research on the topic of stigma is rather sparse. And so it's another area that we probably need to pay a little attention to. But there was a study done of trained mental health professionals. And they read a passage, and during that passage, the term that was used was substance abuser. So then another group read that same passage and it was worded a little differently. And it said, a person with a substance use disorder. So depersonalizing that term made a very tangible impact in the outcomes of this study. So, let me find my outcomes here. So I guess the solution here that we can talk about is that by humanizing stories and by using the first person when you're speaking of someone, a person with substance use disorders, that those are some small ways that we can help to mitigate the power of stigma. Kristen, are you getting any comments?
Yes, I am.
Okay.
Actually, I had Marianne had talked a little bit about her experience with dealing with some stigma. So Marianne, you're welcome to unmute and give your comments. And then I know that Kate, you also had a comment as well.
Oh, great. I would.
Hi, as an advocate, I mean, at MHAM, we do a lot of advocacy. I recently had a situation with a woman who had schizophrenia, who I learned had been taken to the emergency room because she said bugs were crawling on her skin. And the emergency room did not take her seriously. And so the social worker that was working with her took her to her dermatologist and found out that the woman indeed had scabies. But the emergency room completely ignored her. That's just one example
Yes,
of situations that I deal with. Thank you.
thank you for sharing that. It's a powerful
Yeah,
example.
hi. I'm Kate Dahlstrom. I'm the board president of NAMI Grand Traverse. So we're up here in Traverse City, and NAMI, of course, is always National Alliance on Mental Illness, trying to combat stigma. And we definitely see more stigma in our hospital, our Munson Hospital Emergency Department than probably in the general public. And we actually formed a small group of us that started meeting with some of the actually higher level Munson individuals, chief operating officer, emergency room nurse, to try to improve the situation. And after 3 or 4 meetings, we really weren't able to make any progress and kind of pretty much gave up. But it's definitely a problem. And, individuals acknowledge that, maybe not Munson, but they often take the position that it's not our responsibility to treat people with mental health disorders or substance use disorders. And I think that's part of it, is that they don't feel that that's, and that's totally wrong. I mean, it's, the body is an integrated unit, and the physical issues, interact with the mental. And so it's really sad. And I think part of that maybe is, the problem with medical schools, and that they need to do more training in the whole integrated body.
Kate,
So
I heard
yes,
you say that you quote unquote gave up. What did tell me a little bit more about that? Was it not having impact on the people that you were meeting with?
oh, so our meeting, yeah, so we had, it was, in addition to the stigma, which we asked for more training, we thought that, that would be a way to minimize that. But there were some other concerns that we had. In fact, Munson does have an adult psych unit. It has 17 beds. And so they do have staff in the hospital who do treat mental health disorders, and they do treat, substance use disorders. They have an outpatient behavioral health. So we really didn't think there was any reason why people in the emergency department shouldn't get compassionate care and appropriate care. In any case, we also asked for, when people were discharged from the inpatient psych unit, that there would be better follow-up. So there were a number of things, Ray, that we met with them about and gave them specific examples that experiences that various families had had. But honestly, I think, it's kind of there's a certain amount of we do know wrong here. We're Munson and we have a monopoly, and I don't know, it's really sad, but we didn't
So
make much progress.
there's a group in Grand Rapids, emergency care specialists, ECS, and they staff emergency rooms around the state. And we have some representation on our advisory board from that group. And so that's very heartening that, the head of this company, emergency care specialist, is really committed to educating and connecting behavioral health resources with their emergency room. So yeah, so that's been hopeful for us to have that.
Yeah.
At
And they
Sanford.
provide the doctors for the emergency departments, right? So I think
Yes.
that's what they may provide doctors at Munson, but then I think the nursing staff is
Yeah.
employed directly by Munson. Is that correct? Or would you say
Yeah, I
that
bet that's true. Yeah. Well, thank you for sharing that. Yeah, that's a long way to go on that. This one, I just want to mention the self-compassion. We have groups and therapies around self-compassion, because people do come through the door feeling so judged and so shameful about what's going on. So, being able to provide an environment that's unbiased and non-judgmental really allows the people to shift from, fear to hope. And that again is one of the biggest game changers we see, is that when someone is treated with dignity and respect and acknowledgement of their disease, it really gives them that permission to, be hopeful. So self-compassion. Okay, so are we making any progress in this area? Couple things. One, some studies were done after the pandemic, and what happened during the pandemic is that there was in fact an increase in compassion for mental health and substance use disorder, that didn't necessarily exist prior to that, that it triggered a lot of displays of pro-social behavior, meaning that the pandemic really inspired some new compassion and some charity. So, it's a terrible thing that we went through, but maybe there's been a little bit of a shift. The other, okay, so I always just like to go back to the 2017 National Geographic. So this was in between opening our Cherry Street house and our John Street house. And my husband and I were going through the airport in Chicago O'Hare, and outside of the bookstore was a stand where they put, you know, the bestsellers or the new magazines, the new releases. So National Geographic is the oldest publication, 1888 in our country. And so this was out in the hallway at the Chicago O'Hare Airport. And I was so excited to see this on the cover that oh my God, look at what's here. And my husband was a little embarrassed being in the middle of the airport, but this was sort of the beginning of seeing it on the covers of magazines. We do see it now at, at the checkout, line at the grocery store. You'll see it. Time Magazine had a big spread maybe a year after this. Interesting to me. Anyway, I don't want to put that word in your mouth, but these all came out after the 2016 Surgeon General's report with these covers of magazines and publications. And so let's see, the liver. There was a day and time where if you were in line for a liver transplant for addiction, for substance use disorder, that if someone came into that line who had cancer, then they trumped you and got to the head of the line. That is no longer legal. So if you're waiting for a liver transplant for substance use disorder, that you can't be put to the back of the line anymore. Sesame Street, this little green character, her name is Carly, and she's in foster care because her mom was in treatment. And what I learned after I heard about little Carly is that Sesame Street actually has a philanthropic and social arm. They have a part of it that they get together and use their resources to break down the stigma of parental addiction and then help families, in their words, build hope for the future. And so this was an effort towards teaching our children to understand what's going on in this area. So I'm going to conclude with a couple of ideas and quotes, if that's all right. So this is one of my favorite slides because it really shows that self-compassion and that caring and that love for those struggling, that words can wound, and they have great power to discriminate and exclude. So what we can do is, help change that narrative by the words that we use. So this is what I'd like to say, is that each of us has a role in supporting people through the challenges of mental health and substance use disorder. And to ask yourself, what simple act of kindness can you provide? And there's a story, and this story is about a man who died by suicide jumping from the Golden Gate Bridge. And in his apartment, it was found that he had written a note, and the note said, "I'm going to walk to the bridge, and if one person smiles at me on the way, I will not jump." That was out of the New Yorker. So I think that's just a really simple way of reminding us about, that human compassion, that this disease is one of the few diseases that can heal with love. And disease management is successful across the lifespan. And that we are learning, I think, to accept that mental health and substance use disorder is a part of the human condition, and that we just need to keep working at chipping away at these barriers so that people can get the help that they deserve and need. Is there anything else? I would love to hear any comments that anybody has or any reactions to some of this.
Sure. Christian mentioned, I think it's important to guide youth perspectives in that way. I feel like there should be more of those subtle topics in children's media. Thank you for sharing that. And Christian, you're welcome to unmute yourself if you want to add anything more to that, or if you have a question.
Well, I think it is important. It speaks to, kids they're scared of what the behavior that they're seeing in their parent. And so, yeah, bringing it to the children's programming like that is, I think it was a huge game changer. At least it felt like it when I saw the little Muppet Carly.
So I have a question. It's a specific case that so at NAMI, we have a NAMI navigator who helps people find, different behavioral health resources. And in this particular case, actually, I helped this mom whose daughter, 42 years old, never had any history of substance use or mental health disorder. She had recently had a very complex surgery with her nasal passages and was in surgery much longer than they expected. In any case, so about a week and a half after that, the daughter, who lives in Chicago, was found, was missing for a while. Then she was found crouched in some space, and they ended up taking her to the hospital, and they felt, like that she'd had a mental health breakdown of some sort. And the mom, of course, with HIPAA, it's almost impossible. And we did advise the mom to try to get a consent to share, release of information, whatever. But the mom and I think the woman's husband both asked that there would be an MRI, or I don't know if the PET scan is more the proper medical route to go with a brain if you're looking for a possible problem because of that surgery she had. Anyway, they asked for an MRI and were just flat out refused to have that. And it's sort of like the scabies case, right? There could very well be some physiological reason for a 42-year-old to suddenly have this kind of breakdown, and yet they flatly ruled it out. I mean, what would you say? Do you think that's appropriate to rule that out, or would a PET scan or be maybe the best route to go
Well,
with that situation?
okay, I'll go ahead and take an answer, but is there anybody out here that would like to speak to that? There's people with the hospital system that might have a response. So something that we see is that concept of denial, which is, in my opinion, an overused word these days, kind of become cliche. But when you're talking about the word denial in terms of substance use disorder, maybe mental health too, I'm not as versed on that, but that denial is, the brain telling you that something doesn't exist or doesn't work, and it's really the survival of that disease trying to protect itself. And so the person believes that, right? So if someone in that situation they say to that person, well, let's rule out something in a brain scan or an MRI. And I don't know that I'm answering the question directly, but if you can rule out other things so that the evidence, if you will, speaks to a mental health or substance use disorder diagnosis, that it's then the brain, that denial part of the brain, has a little less wiggle room. Does that make sense? But that didn't
It
answer
does.
what you were
We
asking
couldn't,
exactly.
but the frustration was that the psychiatric hospital in Chicago, where she ended up, refused to do an MRI or a PET scan, refused to
Oh, they
consider that
refused it. That's right. Okay.
there was a physical or physiological reason. And especially relevant, it seems to me, is that she had recently had this surgery of her nasal cavities, which of course is, very close
Right.
to the brain.
I just wanted to share that I do work with youth population, kindergarten through graduation in Oakland and Wayne County. I've been doing this work for 30 plus years. And what I'm finding is that the next generation, they get it. They use much better language. They're far more patient. They understand. Across the board, I want to congratulate the school districts who are doing incredible work of doing social education, social emotional education, letting it be okay to talk about, how you're feeling, what you're doing. I just want to commend, you know, sometimes there's a lot to be, there's a lot of work to be done. But I really want to point out too the great work that is being done and is making a difference. And when you spend a day with like a high school kid and you talk about their world, they're far more open to talking. The stigma is being erased. They say things that my generation would have never said. So I just wanted to point that out, that we're
Well,
making progress.
so you and I don't know each other. You're not a plant in this, planted in
No,
this, but that is a
no,
perfect,
no.
perfect way to end this discussion. That's
Hmm.
Yeah.
doesn't get any better than that hopefulness.
Yeah.
So thank you so much.
Thank you.
Thank you, Barb, for sharing your
So Ray,
comments
you
as
guys,
well.
Oh, you're
your
welcome.
facility is in Grand Rapids, is that right?
Yes.
And can people visit and get some sort of tour?
Sure. Yeah. Here, let me give you my emails are green at
Uh-huh.
sanfordhouse.com. SANFORD house.com. I guess I could have typed that in there, huh, Kristen? Instead of
Okay,
saying it.
I put it in there for
But
you.
you know, if you shoot me an email, then I can connect you with the right person to do that. But we would love to do that, yeah.
Welcome. Thank you for everyone who attended. And Rae, you're always so gracious, you know, when we ask if you want to present. So thank you so much on behalf of MHAM staff, Marianne, that, you know, you
Welcome.
come and
Thanks for having me. I appreciate
give
it.
all this great information. So thank you for being here.